All right, hey guys. This is about the question this morning about the potential outcomes for Part D, which is the Cytochrome C assay after calcium treatment. I would send you a text, but I don't really know how to phrase this in a text, so I'm just going to show you, and hopefully this makes sense. If you guys have questions, you can just let me know though. Right. Okay. So this week we're basically trying to figure out what the mechanism of calcium on mitochondria. So we know that calcium releases cytochrome C from the cell or from the mitochondria in some way. We know that. We're trying to figure out how. So here are the two mechanisms. So let's see if I can show you this a bit better. So this is prior to treatment. The little blue dots are little cyto C, and then this little nice green thing is the mechanism that oxidizes the cyto C. We'll talk about that later. But here's our mito. After calcium treatment, here's our two options. Either one, calcium allows the cytochrome C to be released through pores and keeps the mitochondria intact. Or two, cytochrome C is released from the cell because calcium lyses it. These are our two options. That's basically the only way that cytochrome C can get out of the cell. We're trying to figure that out. So in Part D, when it's talking about the assays and the potential outcomes with high and low activity, which mechanism will be determined by that. So if the cell is intact, this is from Part B, is the calcium treatment. So after calcium treatment in Part B, we are separating the supernatant from the pellet. I don't know if you guys remember that from this morning. But the supernatant, either way, should have cytochrome C in it. Because we have cytochrome C being released either through pores or by lysing the cell, the supernatant should be full of cytochrome C. That's what we're going to use in the Western blot with the cytochrome C antibody. So when we run the supernatant in the Western blot, we should see that it has cytochrome C in it. That's for later. So yeah, either way, these are my arrows. Both arrows go to a supernatant with cytochrome C. Now, here's our difference. If the cell is intact, how we think up here, if the cell is intact, then we'll be left with an intact mitochondria in our pellet. If the mitochondria is not intact and is lysed on this option, then we'll be left with a lysed mitochondrial pellet. So here's kind of the whole thing, if that's easier to look at. But those are our two options. Now, when we talk about testing them for activity, so when we test for activity, we're adding. These are the two that we're going to test for activity, right? This one is getting saved for later. The supernatant up here, saved for later. This is what we're testing. We don't know which one it is. It's going to be one of these. Either our mitochondria are still intact or they're lysed from the calcium. When we test for activity, we're adding the reduced cytochrome C to it. You can see that in post-CA treatment CCO assay. You can look at the different samples and the volumes of what that we're adding. But the last column says volume of reduced cytochrome C. We're adding 50 microliters of reduced cytochrome C to every sample. So whatever it is they're both getting cytochrome C. they're all getting Cytochrome C. Yeah. So if it is our first sample, should just be the calcium-treated mitochondrial pellet with malticide, should just be a control, because either way, these are our two options for our calcium result. Either way, when we add malticide, they should both be lysed. Like, they should both be like this. If we add malticide to this one, it's going to be lysed. If we add malticide to this one, it's already lysed. So either way, the cell is going to be lysed, and we should see activity. Because why the cell needs to be lysed is because the mechanism inside the cell is what oxidizes the reduced cytochrome C, and then that's when we see that kinetic activity. So if we treat it with malticide and we don't see activity, we don't have mitochondria, which would be really bad. So that we should have high activity. If we don't, then we have no mitochondria, or they're just destroyed. So that would be really bad. Yeah. For the other one, though, that's mostly what we want to look at, is the calcium-treated mito pellet without malticide. So the malticide one, just control, we should see high activity for that either way. The calcium-treated mitochondrial pellet without malticide is what we're going to focus on. So, yeah, either when we add the reduced cytochrome C, if we add it and we experience high activity, that means it is lysed. So high activity, our cell was lysed by the calcium, because we are seeing kinetics, which means that the reduced cytochrome C is being oxidized by this mechanism, which means it's available. Yeah. If we see low activity, then that would mean that our calcium treatment kept the cell intact. So when we treat it with the reduced cytochrome C, it can't be oxidized because it can't get into the mitochondria. So yeah, I don't know if that made sense. Hopefully it made sense. But yeah, basically we know if we see high activity without multicide treatment, we know that the cell was lysed by the calcium treatment, which led to a lysed mitopellet. If we see low activity without multicide treatment, we know that the cytochrome C left through pores because of the calcium treatment, which led to an intact mitochondria. Yeah, hopefully that makes sense. If you guys have more questions, let me know. But those are the potential outcomes that we're looking at. I finished the protein purification table. I checked. It should be correct. So we do see high yields, but that's just because it's more concentrated. So that should be good. I finished the other tables in the Excel if you guys wanted to check those. All of the tabs in Excel that are blue, I made them a blue color. Those are all the ones for this week, so for week 2. Yeah. For the first part, for part A, we I know we talked about not making working solutions. We're going to make working solutions. So I'm sorry that I'm kind of flipping that on you, but it would just be easier because if we don't make working solutions, then our volumes are going to be different for everything that we're pipetting, and it would be different for both the protein volume and for the EDB volume, and I honestly just think it would be more work. It would take longer. So that's all in CCO assay 2. So part A would be CCO assay 2, which is cytochrome C oxidase assay 2. And our working solutions are there with all of the volumes that we're going to add. And then our enzyme reaction mixes are also there with all the volumes that we're going to add. And there's the table where we record the kinetics of it. The part B, the calcium treatment, that's all in there. All the volumes are in there. So that should be all set for Jason Mariah for you guys. Protein purification is done. And then the post calcium treatment is what we just talked about. Trying to figure out the mechanism that calcium plays in the release of cytochrome C. So, yeah, all that is in there, and all the volumes should be there. If you guys have any more questions, let me know. If it would be helpful for me to send my lab book, if the procedure on that is a little bit, I know I went back and forth on working solutions, so I apologize for that. If that procedure is confusing, I can send my lab book to you guys, because I know I've said a couple of different things. But yeah, just to recap, part A, we will do working solutions to make our numbers similar for making all of our samples. It's just going to be easier if we do that. So part A, we will do working solutions. That data is in Excel.